I think a lot of people confuse the idea of flexibility with the ability to move your body through space. And actually, there's not as much overlap between those two concepts as we think. Yes, our muscles need to lengthen to accommodate movements like walking, running, and throwing, but even the hallmarks of mobility, like a deep squat or a toe touch, require less specific individual tissue length than we appreciate. And even people who are very stiff probably have enough tissue extensibility in most cases to perform most movements. So why is it that some people can move really well through space and others can't, if it's not about flexibility? The answer is compression. Now, to understand what I mean by that, we need to look at how the human body actually moves through space. We often think of it like a puppet, where our muscles are pulling our limbs around like the strings of a puppet, but actually it's more accurate to think of the body like a big bag of water. You compress into one area to create expansion in another, and that shape change is what allows the movement. Now, if you've got areas of your body that will not expand or will not tolerate changes in pressure, that pressure has to go into different regions. This would be a compensation pattern. Once you run out of those, you run out of the ability to move at all. So to move, we need two things. We need the ability to expand in the first place, and then the ability to tolerate the compression of going back into a smaller space. So for example, if you had to sing someone happy birthday, the first thing that you would do is inhale. And that expansion gives you the space into which you can then compress and exhale to perform the task. Movement is the exact same thing, but most mobility drills that I see do not take this into account. And this is why there is a very inconsistent result pattern with those approaches in terms of improving people's functional movement. In the same way that we don't recommend building strength on top of poor technique, I recommend that we don't build flexibility on top of compressed structures. This isn't getting to the fundamental reason of why they're poor at moving in the first place, and it's only going to give them a greater range of motion through which they can reinforce compensation patterns and put strain on areas of their body that will not expand. It's kind of like having a lot of money in the bank. If your account is frozen, putting more money into that account is not going to improve your spending power. This is why you'll get people who are extremely flexible but still can't perform an integrated movement pattern like a full depth squat. I've seen people who can do the splits and put their legs behind their head and all sorts, but they cannot sit into a full depth squat. And the reason obviously is not flexibility, it's because they cannot tolerate the pressure increase of that position, especially once you start adding force into the equation. Now, something that personal trainers will see on a regular basis is that a lot of people who can't perform a full depth squat, when you screen their individual mobility like dorsiflexion, knee flexion, hip flexion, it's all fine, but then when they put it back into the pattern, they simply can't do it and they fall over backwards. Now, the interesting thing is that a very, very common and very effective intervention for these people is to put a wedge underneath their heels. Now, for some people, this is confirmation of the flexibility model because you're taking away the requirement for dorsiflexion, but for me, it's anything but, because you actually don't need very much dorsiflexion in order to perform a full depth squat. Here, I can show you that I can squat to full depth in flats without any forward knee translation at all. My knees don't even reach my toes, let alone going ahead of them, and yet still putting a wedge under my heels could help that mobility. You will also typically see that in most people who can't perform a full depth squat in a bilateral stance, if you put them in a split squat stance, they'll show all the requisite mobility and flexibility on both sides. Like I said, they simply can't put it back into the pattern when they're stood in a more compressive stance. Essentially, by putting a wedge under someone's heels, what you're actually doing is putting them in a more expanded position to begin with, like allowing someone to inhale before they sing happy birthday. Until you see this model in action and the changes in mobility that it can create, it's hard to really buy into the concept. So I'm going to run through a couple of quick examples I've used with clients in the last couple of weeks. So first of all, I had a client who struggled to squat to depth, and the depth that she could achieve came with a lot of spinal extension as a compensation. Now, when you put her in a split squat stance, she could hit full depth, but there were also more compensations. Her hip would shoot out to the side like this, but she could get all the way down. Now, essentially, the quality that she was lacking was the ability to pronate through her foot. So she wasn't able to put force and pressure into the ground through her foot, and as a result, all of these changes were having to take place upstream. Now, in the split squat, obviously she can compensate for that. But in a bilateral stance, obviously your hips can't shift out on both sides, so she had to rely on more compensation patterns, diverting pressure elsewhere, hence the spinal extension. All we did were a couple of drills that taught her body how better to pronate, and then she was able to line up her hips much more effectively in the split squat, and lo and behold, back into the full squat pattern, she was able to squat to full depth without any compensations or the need for spinal extension. I had another client who came to me with hip pain, and he was very, very flexible. He had really good external rotation, but he had poor internal rotation. Now this shows to me he's got all of that inhalation space, he just can't tolerate the pressure increase as you perform tasks. So all that we literally did a single drill that allowed him to turn into his hip, create more internal rotation, build some pressure through a very small range of motion. We didn't do any stretching, we didn't do any mobility, we didn't even load through a full range of motion. And just by performing that one intervention, he was able to squat to depth without any pain. One final example for the upper body that people will be very familiar with is that you can pull much higher in a chin-up than you can in a pull-up. If you start with an underhand grip in external rotation, it's like singing Happy Birthday on a full inhale. You're going to have a lot more space into which you can pull. If we internally rotate, we're taking space away and we're trying to sing Happy Birthday on an exhale. Much harder to get the full job done. This is why it's so much harder to pull high. Now, something else that we'll commonly see, which flies in the face of the flexibility or even the strength model, is really, really strong people who can't pull chest to bar. Now, a lot of people who've gotten strong have gotten so through doing compressive activities like bench press and shoulder press. So when they're then performing a chin-up, they simply run out of space and ability to continue to internally rotate, the ability to continue exhaling, the ability to continue compressing into space. So they run out of the ability to move. It's not a flexibility thing. I don't know that there are that many people who are struggling just to even get into that position, and it's not a strength thing. It's the ability to continue to compress that they lack. So when people ask me, in short, why don't I stretch? I typically reply with something like, well, because I train through a full range of motion. But actually, that's not really true. Full disclosure, I never train through a full range of motion. I don't perform deep squats, I don't do RDLs for my hamstrings, I don't do pec flies for my chest. I'm always training within a very, very comfortable range, even if I'm using movements that look like they involve really extravagant movement patterns, like sprinting and throwing. The reality of those movements is that no one individual joint or muscle is having to go anywhere near end range of motion, and the reason that they look so extravagant is just the summation of many, many small movements layered on top of one another. And evolutionarily, this makes sense because it's at end range of motion that we experience the highest amount of risk to individual tissues, and it's also the least efficient in terms of creating strong outputs. So the idea that we need to increase that field, increase that range of motion, increase where our end range of motion actually is, just doesn't seem to make sense in a reality that's functional outside of gymnastics, dance, or maybe